Hi, my name's Ariel and I have hereditary angioedema. I have a video of myself having airway swelling and it went viral, and so people reached out to do a little video about my disease. So I have hereditary angioedema. I live in Rhode Island. I've born and raised here. I'm an identical twin. And actually, both of my parents do not have my disease. I actually have a little printout about my disease from the Hereditary Angioedema Association. So usually it's passed down from parents, but unfortunately, both my parents do not have the disease. My twin and I, when we split in the womb, they think there was a genetic mutation. So we are mutants, but in a good way. So it was very random that for me to find out that I had this disease, as my parents don't have it. So a little about my disease: it's a rare, disabling, and potentially fatal genetic disease, and it's from a lack of a protein, C1 esterase inhibitor. So Arissa and I are a type 2. So what that means is that we have C4 inhibitor, but it doesn't function. Like, it just doesn't work well. 1 in every 50,000 people are affected with hereditary angioedema. There are triggers then how you can have it. My personal triggers are stress, definitely stress. Any type of infection, illness, anything like that, anything that would make someone a little bit of a cold, it would be a big problem for me, because then I have to deal with my disease on top of any type of infection that I have or anything going on. Other triggers, flying, which I still do because I love traveling, but it is a trigger, but you got to learn to live with it. Also, other thing for women as well is for their menstrual cycle. Unfortunately, if when it's the time of the month, I swell like the day before. It's like always the worst swelling that I have every time that it's like the time of the month. I know other HAE women completely can understand what it's like. So in regards to what happens is just that randomly at any time my body starts to swell. The spot that I'm most infected, I would have to say, is always like my airway. My port's not accessed. I'm actually going to access it. So then see, so you can see. So what else affects me? I would always say it affects my face, my lips. It can affect my tongue, and it affects my airway. A lot of times there'll be swelling on the inside and outside of my throat, but it's not, mostly on the inside. And what it does is it pushes on my vocal box, on my voice box, my larynx. And so that's why my voice becomes really, really high pitched. As the swelling gets worse, my voice will get higher and higher and higher. So that's when I know that the higher my voice is getting, the higher, like, maybe I should be around more people. It's time to go to the hospital. A lot of people ask, why do you go to the hospital? When is the time you go to the hospital? I go to the hospital when I feel unsafe, when I'm like, okay, I might need to be intubated, so I need to be around people. And when I'm really feel like I'm choking, like I can't really swallow as much, or I'm having like severe difficulty breathing. So those are definitely my triggers in regards to my throat, or like that's my symptoms in regards to my throat. Other things that swell are my stomach. So what happens is my intestines are swelling and it pushes on all those nerve endings in your stomach, and it's extremely painful. But thankfully I take my medication and it gets better. Other places that you can swell is your hands, your feet, your genitals, unfortunately. You can swell anywhere, and it can, for example, other people have triggers like, if they mow the lawn, or it can hurt your hands because you're holding down on it. For example, if I type too much, that, like when I'm doing my papers, I've had my hands swell, which is so painful. What else swell? Anything can swell at any time. There are parodomal symptoms. I will get like a rash before, and then I'm like, okay, or I'll get really sweaty and I'm like, oh my God, I'm going to get sick really all of a sudden, so I'll get my meds. A lot of people ask, why don't you pre-medicate, or why don't you have your medications on hand? And the thing is, it's really rapid. It could be within 30 seconds, I'm fine. In one conversation, I am speaking fine. And by the end, my voice is changing. So I just have to, whenever it happens, take deep breaths and just walk myself through it. When was I diagnosed? I was diagnosed in May 22nd, 2012. I was 22. A lot of people want to know about my diagnosis story, and how I found out. So it all started when I was 19. I started going to the hospital. It was actually October, Columbus Day weekend. And I went to the emergency room with nausea, vomiting, severe abdominal pain, diarrhea, and for like a day. And I was like, I don't know what this is. So I went to the hospital. They kept saying, oh, you have gastritis. Oh, you have the stomach bug. Or, oh, you need to stop drinking. Yes, I was in college, so I was like drinking a lot. So I was like, well, maybe that is okay. It's what you're eating. It's your gallbladder. So I kept like intermittently going to the emergency room. And I wasn't having this overwhelming swelling at that time, and it would be very infrequently. It happened like 3 times in 1 month, and then another month it would not happen at all. And I had no idea why it was happening. I would go to the emergency room. I'd follow up with my doctors. Even though I had crappy health insurance, I kept following up with my doctors. At this point, I already was in nursing school. It took about 3 years till I found my diagnosis. I just kept going to the doctor. In April of 2010, I had my gallbladder removed because they're like, oh, it's your gallbladder. This is what's causing your pain. You need to get it removed. So I had that removed. I've had multiple ER visits, multiple scans. They couldn't really see anything. They just say, you have the stomach bug, go home, you're fine. At this time, I was also having some like breathing problems, but it wasn't that bad. I just thought I had really bad allergies. I would have trouble breathing sometimes. Like, you have asthma. I'm like, okay, all right. Like, they didn't really correlate with anything I was doing. So, and it all happened when I was seeing my GI doctor, Dr. Colleen Kelly. She's the best. But she really is the best. She helped find what happened with me. So it was ironic. It was ironic that she had, she said she received something in the mail about hereditary angioedema from any patients with unexplained abdominal pain. And so ironically, I had another doctor's appointment a couple days later with her after she received some information about hereditary angioedema. So she's like, have you ever heard of hereditary angioedema? And I was like, she didn't say hereditary, she said angioedema. And I was like, well, this one time when I was 17, I went to the bathroom and I looked down and I had genital angioedema and of my labia. I wasn't sexually active. I was, and it wasn't like I did anything. So I went and showed my twin sister. I'm like, we have to go to the hospital. And she's like, we're not 18. We can't go to the hospital. So we have to go show mom. And when you're 17, you don't want to show your mom. So she's like, we're not going to the hospital until I see it. So I showed at 17, I had to show my mom, down there. And she goes, let's go. We have to go in the hospital. So we went to a women and infants hospital in Providence, Rhode Island, and the doctors were like, we've never seen this. Oh my goodness. Like, you don't have a baby. Like, right? Like I was just so swollen down there, and so swollen that they couldn't even do a pap smear. And they're like, did you change your laundry? I'm like, no. And they're like, maybe it's like a perfume, something different. You're just having some swelling. Take Benadryl and you're fine. And it went away. So I told her this story and she goes, let me just test you. What's the chances? So she tested me and it came back positive that I had I was deficient in C4 and I had no functioning of it. So she's like, I had no idea. So she told me that she went into chat rooms from other doctors other GI doctors that heard of this disease and if they have any referrals in Rhode Island or in Boston. So I went to Boston. I went to Brigham and Women's Hospital. And that's when I got confirmed diagnosis on May 12th, 2012. And that's the day when my twin sister was also tested. And that's when the day she found out that she also has this disease. And it was overwhelming. I was 22. I was just finished my junior year of college. I was going into my senior year of college, into nursing school. And it was very overwhelming. I remember the doctor's like, you have this disease and you will now have to do IV therapy every 3 days for the rest of your life. And you can die from it. Yay! And I remember just crying, being so overwhelmed, not knowing what the future is going to be like. And it's just so crazy to see what has transpired over, this will be 10 years since I've been diagnosed.